Hello, everyone. Good afternoon in the London time, 3 p.m. Thank you for all these friends, maybe all over the world from different countries to join this Zoom conference. To be honest, this is the first time for me to organize and host this kind of the Zoom conference. If any technical problems happen, could you just send a message through the chat me? Okay, so you all can see the background as I show before the start. Could you all, just in case some technical problems, could you all mute? Sorry, could you all mute your audio and video to avoid any interrupted? Thank you very much for all your cooperation. Now I'm start my presentation for today's the 1 hour conference. The title for today's conference is Coronavirus Linked Loss of Smell and Test, TCM Strategy. Partly of this presentation has been presented on the Dutch TCM Congress, virtual conference 2 weeks ago. Perhaps some friend from Dutch may be familiar with some of this screen. So that's me. As some of you are familiar, I'm Professor Dr. Tianjun Wang from UK, London. And from on the screen, you can see my email and my Facebook. Also, you can see from the screen, you can see on the left-hand bottom, it's handmade, the coronavirus by my son as a fan. On the left side of the screen, you can see nose with smell from the BBC News. So there is a story about this the imaging. Oh, sorry, what's happened? Oh, yes. Okay. So let's start this presentation. If you have any questions, I think we in total about 50 minutes. Then after that, we have 10-15 minutes for discussion. So let's start from news. Possibly some of you have seen this news from BBC. They said coronavirus are loss of smell and test key symptoms. And this news said a team of King's College, as you know, here in London, looked at the responses from more than 400,000 people reporting suspected COVID-19 symptoms to an app. Of this, in total 400,000 people, it could not. 1,700 people said they had been tested of COVID, we say tested positive. With in total 1,070 tested, and with 579 received a positive result. That means something around 1/3. And among the ones who had the coronavirus infection confirmed by a positive test, 3/5 equal to 59%, around 60% reported loss of smell or taste. This the BBC News based on King's College London research report. The lead researcher, Professor Tim Spector, said, when combined with other symptoms, people may, with loss of smell and taste, appear to be 3 times more likely to have contracted COVID-19, according to their data, and should therefore self-isolate for 7 days to reduce the spread of the disease. So this is BBC News. I believe some of you have already seen this news. In addition, around the similar time on the BBC News is on the 1st of April. Now, then 2 days later, on the 3rd of April, TCM report as well, loss of smell from coronavirus, how to test your sense. So normally we believe fever, cough, or short of breath are the key classic signs of contracted COVID-19. A recent analysis of mild cases in South Korea found about 30% of patients was a loss of smell. In Germany, more than 2 in 3 confirmed cases had anosmia. Anosmia is the same meaning of loss of smell. In response, the American Academy of Otolaryngology, Head and Neck Surgery, and ENT UK, and they are calling for the loss of smell or taste to be added to the screening tools for possible COVID-19 infection. So from other, not only from UK, but from also South Korea, American, and Italy, and Germany as well, they all have reported around the lowest was 30%, the highest one about more than 60% had positive cases, had this report of that loss of smell. Interestingly, the health secretary, as you know, Mr. Hancock speak and government daily update. He said, for me personally, I did lose my sense of taste, but it has come back. So I can assume people who have lost their sense of taste. That's the good news is that in my case, it wasn't permanent. And we know in the UK, the top government officer has been reported tested the positive. Mr. Hancock, possibly with a mildly case, he after recovered, he back to the office, and also he donated his blood for antibody treatment. But unfortunately, you see, no, the Prime Minister Boris Johnson had suffered with quite severe cases. Interestingly, I think one or 2 weeks ago, as we may know, the top movie star Tom Hanks reported on the CNN Entertainment, said his wife Rita went through a tough time than I did. Hanks went to say she had a much higher fever and she had some other symptoms mentioned. Interesting, she lost her sense of taste and smell. She got absolutely no joy from food for a better part of 3 weeks. So this is from some news. Now we, after this news, I'd like to share some of these academic papers published on some journal. The first one is from Dr. Manley, who is the first author of the report from the King's College London. His report said, our study suggests that loss of taste and smell is a strong predictor of having been infected by the COVID-19. Also, the combination of symptoms that could be used to identify and isolate individuals include anosmia, fever, persistent cough, diarrhea, fatigue, abdominal pain, and loss of appetite. This is particularly relevant to healthcare and other key workers in constant contact with the public who have not yet been tested for COVID-19. So you can find the link on the screen. So this is the strong evidence about this loss of smell and taste. It's a strong predict. Next one, just published, I think, 2 weeks ago from the psychologist, the British Psychological Society on the website. It said, is loss of smell an early diagnosis indicator of COVID-19? So they reviewed, they said, recent studies suggested that the loss of the sense of smell is an early symptom of COVID-19. And the recently suggested, as cited from the King College London as well, collect data from over 1.5 million individuals using a mobile app where people noted their symptoms. Out of the 579 people who were confirmed to have COVID-19, 58% reported loss of smell and loss of taste. So this paper suggests these symptoms appeared around 24 to 72 hours before more typical symptoms, such as fever. And another recent self-report study conducted in Iran showed that around 30% of participants experienced anosmia. They also found that reported COVID-19 rated in a region was highly correlated with new documented case of anosmia. So this is from the very recently, the UK review. After all these reviews, as you may know, from the CDC, this is the short of the Center of Disease Control and Prevention of USA. On this report, on this website, it said symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms of combination of symptoms may have COVID-19. It said cough, short of breath, or difficult breathing. Then, or at least 2 of these symptoms, including fever, chills, repeat the shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. So you see, from this government, the guidance from CDC USA has already listed new loss of taste or smell as a early symptom on the of the virus. But unfortunately, in the UK, it's still not listed on the government guidance. Some of you have already aware in China, they are roughly about 2 months early than the Western exposure. It is already from the middle of January, has already an outbreak of coronavirus. So the Chinese people, Chinese doctors has more early impact by this virus. On the other hand, they have already gathered knowledges and experiences for this virus. Although it is still new, but they have some lessons we can learn. And on about, let me see, a couple of weeks ago, there was a very nice video published on the CCTV, as you know, the central of China television, because they published a video to explain the Chinese medicine involved of the coronavirus. For this video, it was very nice. So I shared on my Facebook. Less than 2 days, more than 1,000 shared through my the Facebook. that was the first time on my Facebook shared by more than 1,000 friends, particularly in the Western countries. On less than two days, but now it's already more than 1,200 something shared. So on this video, hopefully you have already viewed this video, but if not, particularly for the Western colleagues, you can still go on my Facebook, which is linked here, to find this video, about five and a half minutes. It was very nice, very good English video. From this video, we can see the Chinese doctors, we integrate with both modern medicine and Chinese medicine, including Chinese herbal medicine and acupuncture. I will mention more some detail later. Another academic paper published early this year from Chinese academy mentioned, they say the title was Neurological Manifestations of Hospitalized Patients with COVID-19 in Wuhan, China. Retrospective case series study published on mid of February, the 24th February. They say in roughly about 36.4 patients had neurological manifestations. More severe patients were likely to have neurological symptoms. And that means severe cases, they have almost half of them, 45.5%. And then the mild cases had another about 30% have neurological symptoms, such as acute cerebral vascular diseases, that means partly about the stroke, impaired consciousness, and skeletal muscle injury. But interestingly, they mentioned the hypergenesia, that means loss of smell, and hypersmia, they both around 5%. So interesting, in China, only around 5% of the patients reported about the loss of smell and test. Connected with, the South Korea, roughly about 30%, and Iran about another 30%. So why in the Eastern countries such as China, Korea, Iran, they report much less than the Western countries, such as in the UK, we mentioned in King's College London, they report 59%. So that is 10 times different of this the loss of smell and the tests. So I got some opportunity to contact with some Chinese academics, including one of the Chinese medical team they visit in the UK. I got the opportunity to ask academics, either the West doctors and Chinese doctors, about this the loss of smell and the tests. None of them report they noticed of these symptoms. I personally assume maybe there are several factors involved of these differences. Of course, one is possible different subgroup of this virus in Eastern countries are more less report. And also on the other hand, particularly in China, this that is so low, only one tenth report of this loss smell and tests. Possible, I personally think maybe a lack of physical examination or the consultation. They more focus on the CT scan or the genetic examinations. This is my personal understanding. As you know, in the Western countries, the doctors and particular, including our Chinese practitioners, we are more focused on these questions, their symptoms. That's my personal understanding. So now, after this background of the research and news, I'd like to share some of my personal study, and of course with some other meetings or conference from some Chinese and top academics and other Chinese doctors as you know, lots of Chinese medicine doctors. I believe more than 500 Chinese practitioners or doctors in China, we call them Chinese doctors. They attend the fight against coronavirus in Hubei and other provinces or cities. So they are more, they have learned lots of the understanding of these conditions. And many of them have treated hundreds of patients with combination of Western medicine and the Chinese medicine. As you know, Western medicine has no cure for this condition. So most of them treatment are the support treatment, but none any medications can cure this virus. So from TCM point of view, smell related to the lung and taste related to spleen. And lung and spleen are different lung organs, but they are all related to the tail meridian and the tail lung organs. As you know, lung is hand tail, spleen is foot tail. And as you know, in China, the majority treatment for coronavirus are the Chinese herbal medicine. But as you know, in the Western countries, most of our practitioners, majority are the acupuncturists. Some Chinese colleagues, we use herbal medicine and acupuncture both. But unfortunately, in this time, most of our clinic has already closed. Not so much possible face-to-face contact. So my share today, we are more focused on the next slides, focus on acupuncture understanding and other related treatment. For herbal medicine, I just list something here as your reference. If you are interested, we can contact in the future. So for Chinese medicine, there are several different stages. So for the first stage, in the early time, even before they suffered from this virus, so we mostly use a famous TCM herbal medicine formula we call Yupingfengsan Plus. That means we use Yupingfengsan plus some other herbs to help to boost our immunity. In China, we will say, to help to prevent this kind of virus infection. So in China, as you know, not only in Wuhan, in Hebei, in most of any other China province or cities, it's very, very widely used, similar of like the Yupingfengsan Plus for the, we say the healthy person, but they are worried to contact this virus, or they are generally Qi deficiency or lower immune system. They are widely to provide with this kind of the formulas. After this the exposure, if some people get the early stage or mildly symptoms, so now in China there are, we call the 3 herbal medicine and 3 formulas are published from the Chinese National Guidance for Coronavirus. The top 2 of them are, the first one is we call the Qingfei Paidu Tang. That means clear the lung and extinguish of the toxin. This is a new herbal formula. They most used for the cold and the damp invade the lung with spleen. This is one typical sample. Another one we call the Lianhua Qingwen Jiaolang. This is already medicine. It's already herbal medicine in China. It has been used nearly 20 years, or I believe at least 17 years after, you know, the 2003, the SARS happened in China. So it was designed at that moment. This formula are commonly used for the heat and the damp invade lung and spleen. These 2 are the famous sample of the TCM herbal formula and herbal medicine are widely used in China and now even introduced to the overseas countries. as some of you are aware, in our Chinese government provide aid for overseas Chinese people through the Chinese embassy to most of the Chinese students in the overseas country, including the UK, and Chinese societies. They provide some antivirus products such as masks and scarves, including 1 or 2 boxes of this 莲花清瘟胶囊. So now 莲花清瘟胶囊 are more widely in overseas countries. Because 清肺排毒汤 is not a formal medicine, it's a formula, should be prescribed by the Chinese herbal medicine, herbal practitioners. But they are all herbal medicine with some of the restricted components or herbs. So they are not suitable for everybody. Include as a sample of the 莲花清瘟胶囊. This one are very good for the heat damp invaded lung and spleen. But unfortunately, some the people, when they suffered or they are worried with mild symptom of virus, they have started already to use this 莲花清瘟胶囊. Some of them are not good response. It's because they are not diagnosed as the pattern of heat and damp. Some of them even with the cold damp, or they have the qi deficiency or spleen and stomach deficiency. Well, after they use this 莲花清瘟胶囊, they even worse. Myself and my team has already received lots of cases like this. Overseas, due to some herbs are restricted, modified formulas needed. So sometimes we use the 清肺排毒. We can use some other formulas such as 净防败毒散 plus or 羌活镇实汤 plus, etc. We use some of the modified formulas based on the principle of TCM theory and the guidance of Chinese government. So this is a very brief introduction of the TCM Chinese herbal formula. But hopeful in the future, we have other opportunity to introduce herbal medicine. But today, we more focus on the acupuncture. So for acupuncture for smell and test, so based on the TCM series I mentioned, the main points we may select, as you know, are the lung and the spleen channels, such as lung 7, 列雀, lung 9, 太渊, lung 10, 鱼际, spleen 3, 太白, spleen 4, 高公孙, and large intestine 4, 合谷, large intestine 20, 迎香, etc. Of course, these points are all easy to locate and easy for whatever for treatment. The main reason, as you know, now in the Western countries, we are acupuncture practitioners. We are not medical doctors. We are not allowed to open our clinic face to face to treat real patients, and of course, not allowed in the hospital. Most of us like that. So we only can online consultation for patients. I heard even some TCM association from their the insurance. They even noticed the such as Brexit, they had already stopped the insurance for 3 months. But luckily, from TCM, ATCM, the insurance body was balanced. The public, they said online consultation and provide herbal medicine are covered by the policy. But we do online consultation. But of course, we can't use needles. So there are some options we can use, such as acupressure. So this we call self-treatment. May combine this self-treatment, we can give them this sample of the points, and also this may combine with sensory points palpitation or assessor. This on this sensory points palpitation or assessor. As some of you are aware, Dr. Yezong, Dr. Liu, Dr. Ye Liuzong are more expertise on this area. He has already given lots of samples. So possibly in the future, we can invite him for some speech. And And also, we can suggest them to myself to use some scalp acupuncture, acupressure. The majority we can use them is the nose, throat, mouth, tongue area. And also, my experience, we can suggest them to use ear seeds. We can suggest them to use the to use the Taiji, the Qigong, etc., etc. Now, I'd like to give some sample of my of this point I use. First point are most easy to commonly used for the loss of smell is large intestine 20 Yingxiang. From name is we call it welcome fragrance. So Yingxiang, also a practitioner will know it's an easy point just next to the nose. So they can use the acute nasal congestion, sense of smell, etc. Sometimes I send this picture to the patients. So I sent this sample of this acupressure pictures for patients. Most people, they are easy to find it. They like it. Next one, I was send a sample of the picture to the patients when they suffering from this loss of smell or taste. It's lung 7 裂雀. To give a sample of these pictures and how to find them, how to acupressure these points. The next point I most commonly use is lung 10. We call it 鱼际. This point are most, as you know, it's and the points most for the heat. So I most use the point for the dampened heat syndromes. So as you use the 鱼际. Of course, for the clinical, we can use the needle for, and this is the moment we use acupressure for the 鱼际. And I will suggest them, as you can see on the screen, I mostly suggest them to use this acupressure on the more on the middle of the first metacarpal, but more slightly harder pressure on the point. I just show them these pictures. Okay, next one. I will mostly use the large intestine 4, 合谷. This point is also commonly used for acupressure for the face problems, nose problems, and sinus issues, etc. But this, as we know, this point is contraindication for pregnancy. Next one I was commonly used is spring 3 Tai Bai. As you know, this is commonly used for acupuncture and also acupressure. As well, I would suggest them to slightly harder pressure on the, harder pressure for on the first metatarsal bone. Next one, I commonly used stomach 44 内庭. This one is most commonly used for the test problems, particularly with the heat, dampened heat. So on the foot, I use most point I used. Next one, I would suggest to use this one. I did not. I just added yesterday. We call the nose, throat, mouth, tongue area from scalp acupuncture. And this picture is a new published. I will use this new created picture on my book. So, and also you can find the name of this scalp acupuncture. It's very close and easy to understand. Nose, throat, mouth, and tongue. Most connected for to the smell and taste problems. And on the right hand bottom, you can see this area are more closely to the general acupuncture. We call the Dumai 23, 上心, and Dumai 24, the 神庭. Dumai 23, 上心, as you know, 上心is the most commonly used point for nose problems as well. So, as a picture here, Dumai 23, 上心. Can you see this one is commonly used for the nose bleeding, nose smell problems, the sinus issues, etc. And also this point is one of the 13 ghost points. So this point is one of my favorite points. Of course, we can use it separately, or we can use it as similar to the scalp acupuncture, which will insert slightly deep with the rapid manipulation. is another point for the DOMAT 23. And for the next one, I will suggest is the ear acupuncture or ear seeds. For acupuncture clinic, we can use ear needles. I even suggest for some colleagues or acupuncturists to use these ear seeds. But as you know, for acupressure, or we can suggest the patient to use this ear pressure, or with some cases, I can suggest them to use ear seeds. In the picture in the middle, you can see this picture is the one picture I take from a patient. She's quite interesting for echo for ear seeds because I used this ear seed for her previously. So she quite good to buy online this ear seeds, and then she did it herself. And now, after this introduction of the theory and the background and the treatment principle, I'd like to share some real cases during coronavirus. As some of you are aware, in early stage of coronavirus, as first early March, and that's only start outbreak in the European countries, including UK, but in China has already much less. We noticed this explosion. So, and we noticed that lots of people are worried and anxiety of this coronavirus. So myself and some of our colleagues from the TCM Forum UK, and also from the Chinese home medicine and Chinese acupuncture and home medicine network, we could HMN. From these two group, we organize Chinese medicine at coronavirus sufferers as similar, not a formal charity, but similar to that as a group of colleagues. We published our contact information, including our phone number and social media contact on public. I publish on my Facebook, but the majority for Chinese people. We after we published so far, after about 2 months, there are more than about 4,000 people, but the majority for Chinese people society. They contact me, contact my colleagues, and several hundred of them, roughly about 15 to 20% of them, contact them for consultation and for some prevention and for treatment. So during my online consultation recently, there are already many confirmed and or highly suspected cases with new loss of smell and taste. So most of them noticed the smell test back with the recovery of the disease. But of course, if they received a Chinese medicine or acupuncture treatment, they are more quickly, but some delayed. Some of the patients, they report to us, they said, very uncomfortable feeling, similar to blindness. Some people, our sense on the day-to-day practice, we do not notice them. But as we lost this sense, it is something terrible. When we lost our smell or the taste, it's a very, very bad the feeling. Possible some of we noticed when we suffering from this taste or smell lost during our flu, we are very unaware. We can't test our food and smell, etc. But on that cases, most of it we have a blockage of nose. But for this patient, they are not. They said some people said can't enjoy the food. Very bad feeling. So this a very uncomfortable feeling for the patients. So TCM and acupuncture may play a value role to help viral suffers. So before the explosive in the European countries, before we start the treatment or help them for coronavirus, sometimes we say we do some armchair strategist or fight on paper. In Chinese, we say 纸上谈兵. That moment in early March, we have not lots of so many real cases. But after our the action published, protocol published, there are hundreds of people contacted. So now we have many real cases treated. So that means our experiences are real. First case, real case. It's the Chinese guy. He started his fever early March after a travel to, I think, to Italy. He mentioned he started fever, increased with dry cough, loss of concentration. Loss of concentration is one of the neurological symptoms. He said, I lost a normal smell, but always smell something that doesn't exist. And also he mentioned his nose was clear. It's not blockage. It's not the catarrhal symptoms. On the day of 18th of March, he got a high temperature, 40 degrees. He was sent to hospital by ambulance. He got the test, and he given antibiotics treatment, and the antibiotics is only for prevention for the bacterial infection, but not good for the virus. But also he was given paracetamol, but no any direct treatment. Next day, he was sent back to the home with no any further treatment. And the next day, he was told confirmed coronavirus positive, but still got a temperature around 38 degrees. He got cough with a bit bleeding. He was very fatigued, dizziness. On the 22nd of March, after contact me, he was given a Chinese herb medicine and also some suggestion of acupressure. He noticed getting better. His smell gradually back in a week time. On the 8th of April, he was fully recovered. From tongue, you can see the tongue was covered, very thick of the greasy and the tongue. Second case is NHS, I think it's NHS nurse. And on the 27th of March, because her father was my patient, so he called me. He knew something about Chinese medicine. He called me. She said, chest feels tight and heavy, fast pulse, and low smell and taste. So she said, I tested positive for the coronavirus. Please help. So she needed to start the herbs to stop virus. Should not delay. Please help. He called me. So on the 30th of March and 10th of April, he got herbs and acupressure. On the 14th of April, she messaged me, said, I'm feeling better, thank you. Palpitation has gone, cough a little less, low temperature, energy level has improved, smell and taste are improving. I'm improving. And last week, she called me. She has already back to work and completely recovered. That's a real case for NHS staff. Next real case is another one. He's a young guy. It's a week ago. His flat med confirmed. Then he got tested positive. On the 23rd of March, he had a fever, dry nose, no any sneezing and blockage. He lost smell and taste, a bit short breath. He started herbs and acupressure, and he got getting better. A low fever, no smell and taste, slowly getting better, but still light, with a bit tired. Then we changed the herbs as well. Then he said he getting general good, a bit fever on afternoon, a bit fever on afternoon, and his smell and taste back, but still a little bit light. So this guy has slightly delayed recovery because his smell getting better, but still some symptoms. So before the end of my presentation, I will say we get a short review. Coronavirus linked loss of smell and the taste are very, very common, as you know, very common. Particularly in Western countries, in most Western countries such as the UK, Italy, Germany, and the USA, roughly about 60% of the positive cases report loss of smell and the taste. This loss of smell, they are new loss. It's not because of a preview sinusitis or other problem. It's a new smell and taste loss. And most of them, they have no blockage of nose. Their nose is very clear, even report their nose with some cold feeling. So if patient with combination with fever and cough plus loss of smell and taste, they are very, very positive. So based on this, my colleague and myself, the experiences, you can say the Chinese herbal medicine and acupuncture very good help for quick recovery and early stage of their symptoms and the help, and prevents them to getting worse, getting severe. So most of the loss can be back in 1 or 2 weeks, and some of them may longer. All right, so this is my presentation, and now I will unmute everybody for about 10-15 minutes, 10-15 minutes discussion. Let me see. We first to okay. Let's see. How to say this? How to make it? Oh, sorry. Well, how to back to the let me see. Oh, let me see. Oh, let me see. Oh, sorry. How to unmute? Sorry, how to unmute everybody? Participants. Okay, so now it's for our anyone because any question?
Can you hear me?
他提问。
Sorry.
还喝着橘子汁儿提问。
Okay, so I need to mute everybody. I should choose bad noise. I should mute everybody.
Bad noise.
Sorry. I'm sorry. How to mute? How to mute everybody?
那可以一块儿听。还刚我没。
How to
一块儿听可以。
Sorry, could you all move? How to move all? Very nice. How to make this chat? Could you send your question? Could you make no noise? Could you send a question? Then I see.
听到了。没声音。
Sorry, it's very noisy. How to make it move?
啥都没有。
How to mute everybody so it's making noise? Let me see. Let me try it. Okay.
You can unmute.
Oh, sorry. I make a mistake. So anyone can
maybe Make mistake.
Could you try?
You need any herbal remedies? I can.
Mute everybody.
I try to mute, but I can't be mute. Sorry, first time for me to let me see if I can. Okay, hopefully I can do something here. Oh, yes. If anyone, I think I already mute everyone. So if anyone wants to have any question, could you just could you just raise your arm for question? Then I can unmute you. If any question, could you just raise your hand?
TJ,
Okay, yes, please.
it's Jane.
I was just.
Who?
It's Jane Melling.
Oh, Jane, please. Go ahead, please.
Right.
Oh. Go ahead, please, Jane. Oh, sorry, I can't hear you. Oh, yes.
Right. Can you?
Go ahead, Jen.
Yeah. Thank you for the fabulous lecture, and very good to see you.
Yes, thank
well
you.
and safe.
Me too. Thank you.
Yeah. And my question is that you mentioned about the difference between a Western patient and the Eastern patient in conjunction to this topic.
Yes.
Have you thought about the age group, the difference age groups in the West and East? Because in the East, like China and South Korea, and they tend to be much older, whereas the West much younger. And for that, because as you get older, you have already lost a large amount of sense of smell and taste. So older patients may not have noticed.
那么少声音呢？哎，你看这什么原因？我怎么听不见呢？这声音小的不得了，你看。
Okay.
If you can wait for your turn, someone else. I haven't finished. So, because of the age difference, maybe that loss of taste and smell came into play as well. Because all the age groups, may have noticed less than the younger age groups patient.
Yeah, to be honest, I did not notice this age difference. But from my experiences so far, my experience, old ages may have these symptoms. Such as my sample cases, 2 of them are very young, 20-something, but 1 of them 50-something. And so sorry, I did not notice of this age difference. I didn't make any analysis. Yeah, possible.
In
the
West, in Korea, the age group, the sufferers are mainly in 70s and in 80s, and a lot of deaths occurred in homes, care homes, and in China as well. So 50s is very young. When we had in South Korea, when there was a patient that came up in 50s, they were really, whole nation was shocked because he said.
I see. I know what you mean. So generally speaking, I agree with you. So the old ages are more suffered from this case, and particularly they are more severe case. For young people, they have suffered, but they are more mildly case. Yeah.
Yeah.
So,
when it comes to coronavirus, if you're in 60s, you belong to younger generation.
Yeah, I see. Thank you for that. Yeah. Okay, thank you for your question.
Thank you.
Yeah, okay. So if anyone have that question, could you just raise your arm so I can give you the mute. The next one is Mikey. So unmute. Oh, sorry. Yes, please.
Yes, let me see if I can put on my, I don't seem to be able to put on the video, but I will just ask. I have seen also with the common cold,
Yes.
Some patients often lose their smell and their taste.
Yes.
And this remains after they are better. It can actually also be permanent. With COVID-19
Yeah.
and after Western medicine treatment, do you know if this is also the case?
I don't think they are the same case. But they are all suffered from this virus, but different type of virus may different with impact to our sense, smell and the tests for the they are all from the pyramidal nerve system. So so far I don't think they are permanent damage, but there are some cases are very delayed.
Okay.
Yeah, yeah. Okay, thank you.
I was just thinking that maybe.
Yeah.
Thank you. Is there any nerve damage? That was my consideration.
Yeah, I think this
Or
temporary or early stage, these symptoms, they are already some damage of nerve, but this nerve, most of cases are temporary damage, but they can be recovered. But if lack of treatment or your system, immune system are still already lower, that may be damage, possible damage in long term. But this is the new disease. We still are new to understanding these cases. So I'm not so sure. But so far, in Western only 2 months, less than 2 months. So we don't know any permanent damage so far.
okay. Also, along with acupuncture treatment,
Yes.
do you also advise change in diet to your patients?
Yes. I will suggest it depends on their symptoms. If they are, the cold damp or heat damp, etc., we will give them some suggestion on the diaries. But today, because short of time, I did not make a detail of this. Thank you for that.
Okay.
But we are suggesting a healthy lifestyle, more exercises, possible some sun, more active sun, and balanced food, etc. Thank you for that. All right, thank you. So if anyone has any question, could you just raise your hand? Okay, so possibly it's not.
Can I ask you one more question?
Oh yes, go ahead, please. You go ahead.
In the Yellow Emperor and also Giovanni suggests that all senses ultimately connected to a heart, the Shen. Have you thought about using some heart point or small intestine point, because they are paired, treating patients with the coronavirus?
Okay, this is a good question. This is related for the sense controlled by Zhangfu organs, which Zhangfu organs contacted. But based on my knowledge, I don't think the sense are controlled by a heart. I more believe different sense controlled by different organs, such as
我不知道，我也不知道为什么。
more for the smell, more for the lung, test more on spleen. But some organs, they are all connected. And also, as one reason I suggest you scavenger. My understanding, all the sense will be directly related for our brain. In this the theory, I have already put on my new book, which I will finish at the end of this month. Hopeful, if in the future, if you are interested in this area, you can read my book, more understanding about the control of the sense. Yeah. Okay, thank you. Any more questions? Otherwise,
I'd like to ask a question, please.
Oh yes, please. You do not raise your hand. So it's Hudwan.
I'm raising my hand in my picture. I can't see a button to raise a hand.
Oh, anyway, so go ahead, please. Are you Anthony?
Yes, I am Anthony, yes.
Yes, please. Go ahead.
Thank you for your presentation.
Thank you.
But the question I have, I do not practice herbs, I only practice acupuncture.
Yes.
If you had to select between one of the two treatment types, whether it be herbs or acupuncture, which would you think is the most effective?
Oh, that's a good question. So the best choice, of course, I say is the combination, both. Yeah, but if we say if you have no only one choice, I would say depends on what's the major symptoms in or in which stage. If in early stage, I would say acupuncture is enough. It's good in early stage. But if slightly delayed or slightly severe, so I would say herbal medicine. At least I would suggest that both of them combination are better.
Yes, some practitioners don't have that luxury.
Yeah, I know that. So if so that's reason I make a more detail about the Chinese acupuncture, less herbs. I know for Western practitioner there are more practice of acupuncture. So I list more detail about acupuncture points, acupressure, scalp acupuncture, ear acupuncture as well. So thank you for your question, Anthony.
Oh, thank you.
Okay.
Can I ask a question?
Who is speaking?
I'm Sue.
Oh, Sue, please go ahead, please.
I just want to ask
Yes.
how to distinguish from normal flu from a convert when people lose the smell and the taste.
Okay, this is the good question. This is something question like how to diagnosis of the new virus. So it's very difficult.
Because in the early stage.
But generally speaking, I would suggest if their nose is blocked with sneeze, with blockage and catarrh, etc., then they are less positive for suffer this new coronavirus. But if their nose are very clear, no any the phlegm, etc., no blockage, they still loss of this sense. I would say more positive for this virus. Is it clear?
Thank you. Thank you.
Thank you. Okay, thank you for that. Okay, so last question. Anyone got last question? 3.
I have got a question. I'm Corinne.
Who is speaking?
Corinne.
Did you know? Oh yeah, Corinne. Yes, please go ahead. Corinne, please. Last question.
Yeah, thank you. It was a great lecture. Thank you very much.
Thank you.
And I was wondering, because I read several articles now published by some institutes, like also the Journal of Acupuncture, I think it was, and both in the first phases of influenza, they both suggested Hegu, like large intestine 4, and liver 3.
Okay.
And that's the 4 gates, of course, but I was a bit confused because I was usually taught that these points would like let the pathogenic factor even more in the system.
Oh, okay.
So I was why they use it and like what you say about it.
Okay.
More experience.
If these 4 gates, 1934 and liver 3, first of all, 1934 is a commonly used point, as I mentioned in the presentation, for any face problem, including this smell and taste. It's allowed. And this liver 3 is a good point for, to encourage the qi circulation, etc. I believe these 2 points are benefit for this smell, for these problems. I don't think these points will make it worse for this problem. So I don't think this is the case. Yeah.
Okay, good. Okay, so it's because we learned in school that it would put the pathogen, like open the system more for.
No. Like, open the 4 gates to explode it, to extinguish, to get rid of this pathogenic. It's not welcome. It's exploded. It's outside. But of course, you need a strong qi.
Thank you very much. Great.
Okay. Thank you very much. Thank you, everyone. So thank you for your enjoy this conference. Yeah, if anyone has any further questions, I'm more than happy. You send an email to me or my Facebook or message, etc. For future discussion. Okay. Thank you for joining this conference. See you later.
Thank you very much.